Good morning, good afternoon, good evening. You are listening to the Revolution Health Radio Show. This show is brought to you by Kresser.com, and I am your host, Steve Wright from SCD Lifestyle. With me is integrative medical practitioner, healthy skeptic, and New York Times best-selling author Chris Kresser. Chris, good morning.
Morning, Steve. How's it going?
Pretty delicious right now. Life is really rolling.
Awesome. Good answer.
Thanks.
Well, we got a really good question today, as usual. And thanks again, everyone, for sending in your questions, and keep them coming, because it's really great to be able to answer your questions and know that what we're talking about is really relevant to what you want to hear about.
Exactly. But before we get to that question, Chris, people want to know, what did Chris and family eat today?
Yeah, it was a pretty stock breakfast today. We had some scrambled eggs and a little bit of fish, red boat fish sauce mixed into the eggs, just to give it some umami. That was a little tip I picked up from Michelle Tam, Nom Nom Paleo. And then we had some furikake on top, which is furikake. It's a Japanese seasoning with seaweed and sesame seeds, and I think some fish, bonito flakes, and a few other things. It makes the eggs really tasty.
Interesting.
And then we had some plantains just sliced and fried in a little bit of coconut oil and sauerkraut. So it's kind of like the old standard, our version of the cereal, toast, and OJ American classic breakfast.
Definitely. Well, that's cool. I had pretty stock as well, just eggs and a banana.
Yeah.
And now I got my coffee.
All right.
Before we get to the question, though, Chris, 14-4, how is it going?
Oh, wow. Yeah, I'm glad you asked. It's been amazing. Over 1,400 people have signed up so far, which has exceeded our expectations, and there's been a lot of enthusiasm and excitement about it, and we're going to do the first webinar for the founders group later this afternoon, actually. And the Facebook group has been super active, lots of conversation, and what's really cool is to see everybody helping each other out in the Facebook group. I mean, we have Kelsey and Laura, my two registered staff RDs, that are in there helping as well, but it's really cool to see the sense of community that's developing there, and people helping each other out, because there are a lot of folks who know a lot, in this community, and it's great to see that spirit of helpfulness there. And so, people are at different points in terms of when they might start and do it, but this initial group, it seems like it's going really well so far.
Yeah, being in the founding group is always a lot of fun, because that's when producers like you and I are actually finding out about new additions we make to the programs. Mm-hmm. And so I feel like being part of founding groups for programs like this is really important, because you get extra effort. There's a little extra figuring it out going on, and a little extra time and motivation that's put into by everybody involved. So that's really cool.
Yeah.
Those people are going to see some awesome changes, I bet.
Yeah, it's great. And if you're just hearing about this for the first time, you can check it out at 14.4. That's 1-4, the numbers, and then FOUR.me. And the opportunity to join the founders group is passed, but you can join 14.4 anytime. There was a little bit of confusion about this early on, but it's not a program that has a definite start and end date, like some other programs where they kind of start a few times a year. This is an ongoing thing, so you can sign up anytime, and you can start anytime, and you can do it multiple times. So go over there and check it out if you haven't already.
Perfect.
All right, so let's give this question a listen. It's from Justine.
Hello. I wondered if you could talk a little bit about which tests you do with your clients. I understand that when you first see them, you give them all sorts of tests. And I just wondered, what do you consider the essential tests? And what are you looking to find out? And how do you choose the brand, the make, the company who does your testing? I'm just really interested in that, because I know there's so many tests out there, and it's quite confusing to know which to go for. Thank you. Bye.
Okay, so I get some version of this question probably on a weekly basis. I figured it was time to finally dive in. We could spend many shows, of course, talking about this, and I'm going to go into a lot more detail on this sort of thing in the clinician training program that I've been talking about, and that's coming up hopefully next year. And the answer, of course, always depends on the patient and what their needs are, and what they're looking for, and what we need to find out. But I can tell you that there are definitely some trends. There are certain things that I do with pretty much every patient that walks through the door, and then there are other things that I would order that depend on the specific needs of the patient. So everybody that gets a case review. So that's how I start with patients. I do a really exhaustive process called a case review, where I have patients fill out several pages of paperwork, everything from a diet.
Chris, don't say several.
Several. A diet survey, a diet journal, a metabolic assessment form, body systems assessment, neurotransmitter assessments. We do a mold and environmental toxin exposure questionnaire. We have a case review questionnaire, like a free answer format, health and medical history, etc. And then we have an initial conversation, and that's when Dr. Amy Nett, who recently joined the practice, does those for me now, and she gets the chief complaints from the patient and has a talk with them about what they want to accomplish, what their goals are, what they've tried so far, what's worked, what hasn't worked, and then based on that, she'll order the necessary tests. So everybody gets a case review blood panel, and this is a blood panel that I've put together over the years and kind of refined and tweaked, which covers most of the basic stuff like blood sugar, lipids, comprehensive metabolic panel, thyroid panel, various nutrients like B12, magnesium, vitamin D, some inflammatory markers like C-reactive protein, homocysteine, things like GGT, alkaline phosphatase, lactate dehydrogenase, and then a CBC with the basic immune markers. And this is really helpful because it just gives me information about how the basic body systems are functioning, and these are crucial for everybody. And
yeah, I was going to interrupt you for a second there and play a little devil's advocate. Everybody needs that many tests, Chris. That seems like a lot of tests right out of the gate already. If if you're a long-time listener to the show, maybe you don't have that opinion, but I think some people are going to think that.
Well, certainly everybody doesn't. But people who are coming to see me are sick and have typically been sick for a long time and have typically seen anywhere from 3 to 4 to 15 to 20 and upwards doctors. They've typically traveled to see specialists, sometimes in other countries, certainly in other states. They've typically seen multiple different alternative medical practitioners, everything from naturopaths to chiropractors, acupuncturists, homeopaths, energy healers, shamans, you name it. They've typically spent thousands of dollars on supplements already and medications and herbs, and done all kinds of special diets, and they've been at this for a long time. So for a patient like that, yes, they do need all of those tests, because we need to figure out what's at the root of their problems, which is what the goal is with functional medicine. And if you
got half those tests last year?
Well, things can change pretty quickly. That's the thing. Like TSH can change daily and even throughout the day. Blood sugar can certainly change on a daily, weekly, monthly basis. Lipids can change a lot. So certain blood markers are more stable over time, and I do review other, previous lab work as part of the case review process. But to really see what's going on now, more recent lab work blood work is necessary. But even for people who aren't that sick and haven't seen all of those different doctors, this kind of testing is really illuminating in a lot of cases. So it's just a different approach. The conventional paradigm is we'll wait until you develop a serious illness, and then we'll use drugs and surgery to intervene usually at a point where that illness is usually progressed so far that it's difficult to reverse. That's kind of the conventional paradigm. The functional paradigm is let's be proactive and let's prevent these diseases from occurring in the first place. And that means it's much easier and when you do that, when you catch them early on, it's far easier to intervene and make changes than it is if, for example, with a blood sugar problem, if you catch it at a stage when you've got high normal blood sugar or even low normal pre-diabetic numbers, it's going to be far easier to intervene, and there's a potential to reverse it. Whereas if you wait until there's full-fledged type 2 diabetes with beta cell destruction, as far as we know, the beta cells don't grow back. So at that point, you're stuck probably needing insulin, and you can improve things certainly, but you may not be able to reverse it completely. So the conventional approach, all of the intervention and the cost is heavily weighted at the end of the process. So like in the disease intervention side, some of the drugs for like Actos and the medications used for these diseases are thousands of dollars a month, and someone's paying for that. Even if you have insurance and you're not paying for it, your insurance company's paying for it, and therefore your premiums go up and the whole system is paying for it in some way or another. The functional medicine paradigm, more of the cost happens up front with this kind of lab testing. And I really believe, and there, some of my colleagues in the functional medicine community, like Dr. Hyman, are working towards this right now, that once insurance companies see how effective this kind of medicine is and intervene, and how effective it is and cost effective it is to intervene earlier, you spend a little bit more up front. The cost of these labs pale in comparison to the cost of the kind of drugs that become necessary when someone progresses to full-fledged type 2 diabetes. So, understandably, patients complain about the expense of functional medicine labs, and that they have a right to, because insurance should be covering those expenses. And if you spend a couple $1,000s on lab work up front and avoid type 2 diabetes, that could prevent an insurance company from having to spend literally tens of thousands of dollars per year for many years to come to treat that disease. So it's a different way of looking at things, and my patients, as you suspected, Steve, don't typically have a problem or need this kind of explanation, but it's for those who are unfamiliar with this kind of work, there it is.
Yeah, I think it's really good that you explained that, and I think it opens up two things I just want to comment on real quick. First is that I think of like yearly lab work like this, of checking the whole body, almost like your report card. And so, you don't enter into a four-year college and really get no updates except for maybe a pat on the back or a scold from, if you didn't do this lab work for 4 years, it'd be like you just got patted on the back or some scolding looks from your professors. And then at the end of 4 years, you found out either you graduated or you didn't, and you had no idea what was going on the whole time.
Yeah.
So there's feedback in almost every system around the world, from the financial system to how we do education. But the medical world is slowly starting to get this feedback idea. And so I think, as you said, it's even going to pay for people to be investing now before the insurance companies really get it. Because I think that where we're going in 10, 20 years is that if you didn't pay right now, they're going to make sure you're paying in the future. It's going to catch up, and everybody's not going to be subsidizing everybody like it is now.
Mm-hmm. Yeah, and there's also new developments in technology that are happening all the time. there are entrepreneurial companies that are trying to make the blood testing cheaper. There's all the quantified self tools that are becoming available. So it's going to become easier and easier for people to get this kind of data, and it already is. I mean, you can already go to places like directlabs.com and order your own blood work, which without even a doctor's order. And I have actually mixed feelings about that, but it's something that you couldn't do even, I think, 5 years ago. And so things are going to be really different in the next 10 to 15 years. And this is, it's a necessary change, and it's one that's going to help people stay healthier and prevent and even reverse disease. So, and that's what it's all about. So let's go on to talk about some of the labs. Now, I'm glad you asked me that question, and I'm glad that we had a chance to talk about it, because it's definitely an important topic. So that's sort of the minimum testing that someone would get when they come to see me as a patient. But I can tell you that probably 95% of patients also get a full suite of gut testing. And if there's one thing I've learned in working with people for as long as I've been doing it now, it's that, and of course we've talked about this ad nauseum on the show, and I've written about it elsewhere, is that the gut is really the key to health. And if you don't have a healthy gut, you can't be healthy overall. And this is true even when you when you don't have gut symptoms. So I want to tell a story actually just from yesterday in the clinic. I talked to a patient who came to see me, and his primary concern was his lipids, cardiovascular health and heart attack prevention. He had high cholesterol, also high LDL particle number, which we determined, but he had really no other symptoms. He overall felt really good, didn't have any obvious gut symptoms, slept well, had good energy levels, didn't have any complaints. Main thing he wanted to do was make sure to reduce his risk of a future heart attack.
Do you have a family history of it?
He had some family history, but he was just kind of alarmed he had done some of this testing on his own. He was kind of alarmed by his high levels, or he had had it done with his doctor. So I proceeded to talk to him about all of the underlying causes that can contribute to high LDL particle number. And of course, one of those is gut inflammation and intestinal permeability. What happens is, if with a leaky gut, endotoxin like LPS, lipopolysaccharide, can get into the bloodstream, and then the liver will manufacture more LDL particles to deal with that. Chronic gut infections can also raise LDLP for a similar reason. Poor thyroid function, because the LDL receptor requires T3 to function properly. Of course, metabolic issues like insulin and leptin resistance can cause it. And then, of course, you have genetics and a few other causes. But with no symptoms, it was interesting to talk to him about that and to convince him that we needed to order some stool testing and SIBO breath testing and urine organic acids profile to determine if he had gut issues. And I mean, he already knew a lot of this, so it wasn't hard to convince him. He was totally game to do it. And so we ordered that kind of testing, and guess what? He had evidence of SIBO and fungal overgrowth on both the stool test and the urine organic acids profile. And so we set about treating those, and I just talked to him yesterday and we tested his we tested his gut test to make sure all that stuff was gone. And he had something like 12 or 13 markers that were elevated on the organic acids profile, and that went down to 1. And then the yeast that was on his stool profile disappeared completely. And so there was really no evidence of SIBO or fungal overgrowth anymore. And we redid his lipid profile, and his LDLP went from like 2,600 to 1,700, which is still a little bit high by conventional standards, but a really significant drop. His small LDLP went from like 1,100 to 100, which is well out of the range to being well into the range. His HDLP increased, pretty much all of his lipid markers improved in a really dramatic way. And that was only by addressing the gut issue. We didn't even get into some of the things, the natural things you can do to adjust lipid profiles, like changing the diet and tocotrienols and panathine and all the stuff I talk about in the high cholesterol action plan. So that's just an example of where the gut can contribute to things that in a really significant way, even when you don't experience any gut symptoms. So that's why pretty much everybody who walks through my door gets this gut testing. And there are a lot of different ways to test the gut, but the three things that I consider to be important are stool test, breath test for SIBO, and then a urine organic acids profile that looks at certain organic acids that are byproducts of bacterial and fungal metabolism, so they can indicate bacterial or fungal overgrowth in the GI tract. And in terms of stool tests now, I'm currently, this changes as I learn more and as new information comes to light. I used to run Metametric stool panel, but I lost confidence in that after I read a study that didn't mention Metametrics by name, but I think it was, it was pretty clearly about Metametrics. And I was just, after reading the study which assessed the accuracy of the DNA PCR method that they were using, I lost confidence in it. And then Metametrics was purchased by Geneva. And so, a whole bunch of stuff happened there. So I'm currently using the doctor's data comprehensive stool analysis with 3 samples. It's a combination of stool culture, really advanced stool culture method, and something called the MALDI-TOF method, which stands for matrix assisted laser desorption ionization time of flight. Mass spectrometry, and it's a proteomic method of identifying bacteria and yeast, and it works by measuring the unique ribosomal protein fingerprints of microorganisms, and then they compare the spectra with a reference database for verification and identification. And it's a lot more sensitive than many other technologies. They can identify over 1,200 species of bacteria and yeast. It's used by NASA, I believe, to detect microorganisms in launch vehicles. It was ranked 3rd in the Cleveland Clinic's top 10 list of medical innovations that will improve patient care last year. And I like it because it also has other helpful markers. It's a stool analysis. It's not just looking for parasites and yeast and bacteria. It has some inflammatory markers like lysozyme and lactoferrin. It measures stool pH, SIGA, secretory IgA, which is a marker of gut mucosal barrier integrity, short-chain fatty acids like butyrate, beneficial bacteria, and some other interesting stuff. And we also sometimes use BioHealth 401, which is another culture-based stool method, and sometimes we'll run them together side by side. For organic acids, we tend to use either the Geneva or former Metametrics Organics Comprehensive Profile or the Organic Acids Test from Great Plains Laboratory. And this is probably, if I had to choose one of my top 3 tests, I would say the urine organic acids is up there, because you can learn so much, not just about the gut, but organic acids are also byproducts of cellular metabolism. And so you can learn, and there are all these cycles in the body, and things tend to kind of go around in the cycle, and getting from one step of the cycle to the next step requires an enzyme to convert one metabolite to the next metabolite in the cycle. And each of those enzymes requires certain nutrients to function properly. And so if a nutrient is deficient, that cycle will not complete, and you'll get a buildup of the metabolite or organic acid that's at the previous step in the cycle, and that spills over into the urine, and you can see it show up in the urine, and then that can give you some information about where these cycles are broken and what's happening in terms of metabolism, cellular energy production, fatty acid metabolism, carbohydrate metabolism, neurotransmitter breakdown metabolism, detoxification, methylation. So some of the most one of the most sensitive markers for B12 deficiency is methylmalonic acid. That's an organic acid that's on this test. Formiminoglutamate acid is probably the most sensitive marker for folate deficiency, for tetrahydrofolate deficiency, and that's on this test. So you can learn a ton of stuff on these organic acids panels. Unfortunately, they're not very easy to interpret for patients. So this is definitely something you need some training and education about, and it's something that your doctor practitioner can help you interpret, but not something that's too easy to figure out on your own. And then there's a SIBO breath test, and we used the one from Geneva. We've used also one from Commonwealth Labs as well, but I think we prefer the one from Geneva because I think it's more accurate in reporting methane, which we talked about on a previous show. And this is one of the ways to test for bacterial overgrowth in the small intestine, and it's a good test overall. There is potential for false positive and false negative, so you can't rely on a SIBO breath test results alone. But when it's combined with the organic acids and the stool test, I think that's a really great combination for assessing gut health. All right, I gotta take a deep breath. That was a lot of information there.
Yeah. I think it's important to mention that, number one, no test on the market is perfect, and there are, there's downsides and upsides to every single test on the market. And I think, especially with gut testing, what most people don't want to hear is that a lot of times it does take multiple tests to figure out exactly what's going on. And so that's why the retesting is such a big deal. That's why if everything points to the gut, and like for instance, your just one stool test that you did previously came back negative, you might need to do two at the same time. I mean, personally, Jordan and I saw hundreds and hundreds of case examples where people who, like you said, those people who have been through everybody and just haven't seen results, really they just needed a couple of the same type of tests from different labs at the same time to really make sense of what was going on, because they knew they had a gut issue. Everybody kind of thought it, but the generic tests or the single test at one time, not seeing a whole picture, yielded no results.
Yeah, that's a great point, Steve, and I really want to reiterate this. What you said is lab testing is only one tool in making a diagnosis, and a good clinician won't rely on lab testing alone. They'll rely on their clinical experience, they'll rely on the patient history, signs and symptoms, and all of that is put together to develop a diagnosis. And lab testing at the end of the day is just a snapshot in time. So there's many times where we'll see a blood marker that's off, we retest it a week later, it's fine, and we retest it 4 months later, it's fine. And it's just a temporary blip that can happen. There's also times where we test really expecting to find something and we don't find it, and the fact that we don't find it doesn't necessarily mean that it's not there. A good example of that is thyroid antibodies. Something like 20 to 35%, depending on what study you look at, of people with Hashimoto's don't test positive for thyroid antibodies. So you can't do a thyroid antibodies test, see that it's negative, and then rule out Hashimoto's for that reason. You have to look at their symptoms. You have to look at other methods of testing like histology or thyroid ultrasound. You can maybe do multiple antibody tests to try to catch it at a time when the antibodies are elevated, because that tends to be cyclical. So there are many, many different examples where the testing is insufficient for one reason or another. Of course, that doesn't mean we shouldn't do it. It just means that it's only part of the overall picture. So let's quickly go through some other tests that I will sometimes do. I'm not going to go into a lot of detail on these, but I'll just give you some headlines. So for hormone testing, I'll often use the BioHealth 201, which is the diurnal cortisol rhythm, 4 cortisols throughout the day, to figure out what your cortisol rhythm is, in addition to the total estimation of the total amount of cortisol. And then they test for DHEA as well. 24-hour urine hormone testing is also, or it's arguably more revealing, because they test not only cortisol but all the different cortisol metabolites like tetrahydrocortisol, tetrahydrocortisone, and then they test not only DHEA but also all the other sex hormones like testosterone and estrogen, progesterone metabolites, but then other androgens in the pathway like androstenedione, And it's important to know about these because you can, there are certain things you can figure out that you can't figure out really any other way. For example, yesterday I had a patient who had high DHEA, and he had some other high androgens in the pathway, but his testosterone was low and his estrogens were low. And what you figure out when you look at all the pathways is that in that case, the enzyme 17 beta HSD isn't functioning well, and then that takes you down a whole nother path of investigation, and you're not going to figure that out by just testing testosterone or even estrogen and progesterone in the serum or in the saliva.
So the 24-hour test is a different one than the Bio 201. What's the name of that one?
That's a 24-hour urine test. So that's Geneva Complete Hormones. There are other labs that do 24-hour urine hormone testing as well. That's the one we've been using. We are investigating a new lab, which is really interesting. It's a dried urine, 4 samples of dried urine throughout the day. So it kind of combines the diurnal cortisol profile with the advantages of 24-hour urine profile.
Do I have to drive my own urine?
All you have to do is produce it, Steve.
Okay,
Don't worry about that. So I'm gonna report back when I have some more information about that. We haven't. I think I just ordered the first panel with them yesterday, so I'm excited about that. But we'll see how it goes. Methylation, I'm doing an increasing amount of work there in that area and finding it to be really helpful and critical for some patients in their recovery. I do genetic testing to determine what the single nucleotide polymorphisms are, the genetic mutations in methylation-related genes. But that's not enough. And I know I've talked about this before, but it's a pet peeve of mine that when practitioners just test for genetic mutations and start supplementing people only based on those mutations, because a mutation of a gene does not alone imply dysregulation of that gene. It means there's probably a greater likelihood that the gene won't function well, or the enzyme that the gene produces won't function well, rather, but it's not a guarantee. And you can have people with genetic mutations in the methylation pathway that have their methylation works perfectly well, and you can have people who have no mutations or really minor mutations in the methylation pathway that have serious methylation problems. So genes load the gun and environment pulls the trigger. Environmental factors like diet and lifestyle, toxic exposure, etc., are far more important in terms of determining methylation status, which is why I always use a functional methylation profile that tests for patients' actual methylation capacity, and that's with a lab called Health Diagnostics and Research Institute. I'm hesitant to even bring this up because they're the slowest lab that I work with. They take up to 10 weeks to get results back, and so now a bunch more people are going to be ordering their tests, and I've just shot myself in the foot. Thanks a lot. No, so it's a good panel. I hope they can ramp up their staff and get more people on board so they can turn around the test results a little bit quicker, because 10 weeks is a long time to wait for a test result. For immunological testing and food intolerances, chemical sensitivity, etc., I use the Cyrex panels. We order Array 3, which is the wheat gluten proteome gluten intolerance panel. Array 4, which covers other cross-reactive proteins. Array 5 is the multiple autoimmune reactivity screen. It screens for just autoimmunity in general, production of antibodies to several different tissues. Array 7, I think, is a new profile that relatively new, where they screen for reactions to certain environmental toxins. And I know Aristo Vajdani, who is the director of the lab, really believes that when it comes to environmental toxins, when you have like low level exposure to them, like pretty much everybody does now at this point, living in 2014, it's not, when the levels are low, it's not so much the difference in those low levels that determines how you react, it's your immunological response. So for example, if you produce antibodies to mercury, even low levels of mercury in your body can be a real problem, whereas somebody else who's not producing antibodies may have no issue with very low levels of mercury. So That's an interesting test, and I heard recently that Cyrex is coming out with an Array 10, which is going to be another food intolerance test that looks at intolerance to foods beyond the cross-reactive proteins. So that should be interesting to see.
Do you use Array 2 for leaky gut, or do you use
I
something
don't use
else?
it that much. I think in most cases it doesn't really change how I treat. And I think SIBO, parasites, all those other things are really the underlying causes of leaky gut. And so we address those things. And if a patient continues to have problems, then we might go ahead and do Cyrex Array 2 for leaky gut. We're getting kind of long on this episode, so I'm just going to quickly mention a couple others and then we'll wrap it up. Maybe we'll do a part 2 sometime. Nutrient status, I like the Geneva Nutraval or the Metametrics. It used to be Metametrics had one called 1, and they're both under Geneva. They're fairly similar. The 1 has a few more markers than the Nutraval, so we tend to run that. Amino acids is urine amino acids that could go through Geneva or doctor's data. That can be helpful, especially for people with methylation issues or autism, kids with autism spectrum or behavioral disorders. And then for heavy metals, we use Quicksilver Scientific, Dr. Chris Shade's lab, which does a great job with that. So that's a lot of stuff there. Hopefully it's helpful. I want to emphasize that, just because these are the labs I use doesn't mean that the labs your doctor or practitioner are using are not any good. We all have our own preferences for various reasons, and in a year, if you ask me this question again, I imagine I'll be using some different labs that I'm not using now, and that's just part of the evolution and the practice of this kind of medicine.
And I can't stop talking on this episode, but I know we need to end it. But it's also worth mentioning on that point, Chris, that it's arguably as important that your practitioner runs a lot of the one specific lab, not necessarily that they follow exactly every lab that Chris mentioned here, because there's nuances within every single lab, and seeing a bunch of symptoms match up to lab results is arguably as important as is the lab company sometimes.
Yeah, exactly. So I hope this was helpful, everybody. Thanks for listening, and keep the questions coming. And go over and check out 144.me and join us if you haven't already. It's going to be a blast.
Yeah, thanks everyone for listening. In between episodes, if you want updates from Chris, make sure you go to facebook.com/Chris Kresser LAC and twitter.com/Chris Kresser. Thanks for listening. We'll talk to you again soon.
Bye.